Welcome to Module 1 of Fall Prevention in the Emergency Department. In this module, we will explore the importance of fall prevention, why it is a critical issue in emergency care, and how we can effectively identify and mitigate fall risks. Let's begin. In this module, we will cover 4 key objectives. First, we will understand the definition of fall. Next, we will identify statistical data and trends to recognize the scope of the issue. We will then explore the importance of fall prevention in the emergency department and why it is critical for patient safety. Finally, we will review current practices and guidelines to ensure best practices are followed. What is a fall? According to the World Health Organization, a fall is defined as an event in which a person inadvertently comes to rest on the ground, floor, or a lower level. While most falls are non-fatal, they remain a major cause of injury globally, particularly among vulnerable populations such as older adults. Malaysian fall statistics. According to the Department of Statistics, Malaysia falls are the second leading cause of injury-related hospitalizations, following road traffic accidents. 14.1% of older adults have reported experiencing falls, with 27.5% experiencing repeated falls. The Ministry of Health Malaysia highlights the economic impact of falls. On average, falls result in 9.7 days of hospital stay, with an income loss of up to 534 ringgit per person during recovery, creating a significant economic burden on families. Certain groups are at higher risk. 18.8% of elderly Malaysians with type 2 diabetes have experienced falls. Risk factors include female gender, age 75 and above, retinopathy, and orthostatic hypotension. Additionally, older adults with limitations in activities of daily living face a 1.56 times higher fall risk. These statistics emphasize the serious impact of falls on both healthcare systems and vulnerable populations. Now let's have a look at the global fall statistics. According to the Centers for Disease Control and Prevention, CDC, falls are the leading cause of injury-related morbidity and mortality in the United States. In 2014, 28.7% of adults aged 65 and above reported falls, totaling 29 million incidents. Of these, 37.5% required medical care or activity restriction, resulting in 7 million injuries. The economic impact of falls is significant. In 2015, fall-related injuries cost approximately $50 billion, with Medicare covering $28.9 billion, Medicaid $8.7 billion, and private payers $12 billion. Fatal fall-related costs alone amounted to $754 million. Falls also have a major impact on healthcare systems. They lead to increased hospitalizations for fractures and injuries, higher medical costs, and greater strain on rehabilitation and long-term care resources. Additionally, falls reduce mobility and independence, often leading to psychological effects, such as fear of falling. These statistics highlight the global burden of falls and the urgent need for effective prevention strategies. Why is fall prevention important? According to Thatfet et al., fall prevention programs are essential in reducing the incidence of falls, minimizing hospital admissions, lowering healthcare costs, and improving the quality of life for patients. By implementing effective fall prevention strategies, we can enhance patient safety, reduce complications, and promote independence in high-risk individuals. Current guideline practices. There are established fall prevention guidelines to ensure best practices in patient safety. The AHRQ guidelines, developed by the Agency for Healthcare Research and Quality, provide evidence-based strategies to reduce falls in healthcare settings. The MOH guidelines, issued by the Ministry of Health, offer standardized protocols tailored to Malaysia's healthcare system. Following these guidelines helps ensure consistent and effective fall prevention practices. The Agency for Healthcare Research and Quality, AHRQ, outlines key strategies for fall prevention. It emphasizes multifactorial assessment, evaluating risk factors such as mobility, medication, vision, and cognition. Targeted interventions are recommended, ensuring that fall prevention plans are tailored to individual risk profiles. The AHRQ endorses validated tools like the Morse Fall Scale for assessing fall risk and the Timed Up and Go or TUG test for evaluating functional mobility. Continuous staff training is essential to keep healthcare providers informed on fall risk identification and management. Lastly, the AHRQ stresses the importance of post-fall protocols, which involve immediate root cause analysis and patient assessments to prevent future falls. The Ministry of Health guidelines follow the 5-FIT framework for fall prevention. First, falls risk identification emphasizes early screening to detect at-risk patients. Next, intervention focuses on addressing modifiable risks, such as medication effects, mobility aids, and environmental hazards. Training is essential to ensure that staff are educated on standardized fall prevention protocols. Team collaboration promotes a multidisciplinary approach, encouraging coordination between doctors, nurses, and allied health professionals. Lastly, follow-up and audit ensures ongoing monitoring of compliance and outcomes. This includes quarterly reviews, environmental safety checks, and ensuring clear pathways, proper lighting, and accessible mobility aids. By following this structured approach, fall prevention can be effectively implemented and sustained in healthcare settings. How can we improve fall prevention? Despite the availability of comprehensive guidelines and effective tools, the process of fall prevention often faces gaps in implementation. To enhance fall prevention, we need to focus on three key areas. First, knowledge, ensuring that healthcare providers understand fall risks, contributing factors, and best practices for prevention. Second, attitude, fostering a proactive mindset where fall prevention is seen as a critical part of patient safety. Third, practice, implementing evidence-based strategies consistently in daily patient care. By strengthening knowledge, attitude, and practice, we can create a safer healthcare environment and reduce fall-related incidents. Research highlights the importance of knowledge, attitude, and practice, KAP, in effective fall prevention. First, knowledge. Studies by Cho and Zhang show that educational interventions significantly enhance healthcare providers' understanding of fall prevention. Ongoing training and education improve both knowledge and compliance, making fall prevention efforts more effective. Next, attitude. According to Davenport et al., positive attitudes among healthcare providers lead to better adherence to fall prevention protocols. Regular training and reinforcement can help foster these attitudes, ensuring fall prevention remains a priority in emergency departments. Finally, practice. Tiedemann et al. Emphasize that effective fall prevention practices involve using evidence-based assessment tools, such as the Tug test and Morse fall scale. Additionally, Thatfit et al. Found that continuous education and training lead to a reduction in fall rates. By strengthening knowledge, fostering a proactive attitude, and ensuring consistent practice, we can significantly reduce falls and enhance patient safety. There are many fall prevention programs that provide clear evidence of their success. Let's explore some of them. Research has shown that multifactorial fall prevention programs lead to significant reductions in fall rates and improved patient outcomes. This is supported by Tiedemann et al., who highlight the effectiveness of such programs in fall prevention. Additionally, Thatfet et al. Found that the implementation of tools like the Memorial Emergency Department Fall Risk Assessment Tool, or MEDFRAT, in emergency departments improves fall risk identification and management. These findings emphasize the importance of structured, evidence-based approaches in reducing falls and enhancing patient safety. Despite the benefits of fall prevention programs, there are several challenges in implementation. According to Ko et al., major barriers include variability in resources, lack of standardized protocols, and time constraints. These factors make it difficult to implement consistent fall prevention measures across different healthcare settings. Additionally, the Lessons Learned from Emergency Department Fall Assessment and Prevention Programs report highlights that inconsistencies in fall prevention practices often stem from the lack of standardized fall risk assessment tools in emergency departments. To address these challenges, a few key recommendations stand out. Continuous education and training for emergency department staff are essential to ensure they are equipped to identify and mitigate fall risks effectively, as noted by Cho and Zhang. Additionally, establishing a core team of fall prevention champions, as highlighted by Thatfet et al., can drive comprehensive and coordinated care for high-risk patients. These recommendations pave the way for stronger fall prevention strategies and improved patient safety. In summary, fall prevention is a shared responsibility that requires knowledge, proactive attitudes, and evidence-based practices. By implementing structured guidelines, continuous training, and effective interventions, we can significantly reduce fall-related injuries and improve patient safety. Remember, patient safety is our priority. Let's continue working together to create a safer environment for all.